What's going on YouTube in class? Today I'm doing skin tear treatment. We're going to start off with the purpose. The purpose is to protect the fragile skin from further damage, and it's to restore skin integrity and prevent tissue damage, protect exposed dermis, to prevent infection, to control bleeding, reduce pain, and to maintain skin integrity, especially for the elderly or thin-skinned. It helps minimize the pain and the bleeding associated with the fragile skin. Alright, and next up we got risk and benefits. So some benefits are that it promotes faster wound closure, prevents infection and sepsis, decreases pain and inflammation. It prevents wound enlargement, reduces scarring, maintains patient mobility and comfort, improves cosmetic outcome so it looks better, prevents chronic wound development. And now we're moving on to risk. So the risk, you can get infection due to improper cleansing, contaminated dressings, poor hygiene, diabetes, further skin trauma from adhesive dressings, aggressive tape removal, improper dressing changes, delayed healing due to diabetes, malnutrition, steroid therapy, poor circulation, advanced age. There's bleeding risk, necrosis if the skin flap is not properly realigned or the blood supply is compromised. So those are all the risks. Moving on to patient teaching, wound care at home. Keep the wound clean and dry and covered. Do not remove the dressing unless instructed by a nurse or a provider. Avoid scratching or rubbing the area. Protect the skin from bumping, furniture, bed rails, pets. Make sure to increase your protein intake, your vitamin C intake. Ensure adequate zinc intake. Drink enough fluids to prevent dehydration. Wear long sleeves or protection skin sleeves. Remove home hazards. Use proper footwear. Avoid tight clothing just to prevent. You're also going to want to prevent any signs of infection immediately. So if you see any redness, warmth, swelling, pus, fever, make sure to report that immediately. Any foul odor, yellow-green drainage, pain, report that. Alright, for monitoring, what you want to monitor is color, drainage, odor, size, the wound edges, tissue color, the drainage, how much drainage, what's the color of the drainage, the odor. If you have an infection, make sure to report that you have a fever. Make sure you get your white blood count checked. See if you have it elevated. If you have any chills. The pain level. So you want to check the surrounding skin for new tears or bruising. Elevate your nutrition and hydration status. You will want to document any wound appearances, dressing changes, and healing progress. Now I'll show you guys a little demonstration. I'm going to be having my mom as one of my patients. Alright, let's do it. Here's a demonstration of what we're going to need and the skin tear itself. We got the skin tear. We need a 4x4 gauze, a wrap, petroleum jelly, and some gloves. So what you're going to want to do is put your gloves on. Grab a gauze. Make sure to put pressure on it to stop the bleeding. And if you can, make sure to close the flap of skin. Cover that up and put pressure on it. That will stop the bleeding. You've done that, you want to go ahead and grab another piece of gauze and get a generous amount of petroleum jelly. Like this. And make sure to cover that up well. Do that. You want to go ahead and grab your bandage and wrap it around. Once you've done that, make sure you bandage it up, wrap it around, and then that's it. That was it for my homework. Thank you guys for watching.